Hi, this video is about the prolapsed disc and what it causes, which is lower back pain and sciatica. It starts with a movement, and here's the spine, and the movement is usually a twist and a stretch. So you've twisted and you've stretched, and when you do this movement, the structure that gets stressed is the disc. Here the disc sits, just tucked in between two vertebrae, where it acts like a cushion, shock absorber. So what you do is you do the twist, and the wall of the disc becomes stressed, and then it tears. And when the tear occurs, the fluid that's in the middle of the disc gets forced into the tear under pressure, and this sets off the first kind of pain that you feel. And that pain, usually you feel it's a deep ache. It arises from your back, and it often radiates out into your buttock. This is the classic pain of lower back pain, which many people have felt. But this isn't the whole story, because normally over the next little while you make another movement, and the tear, again a twisting movement, and the tear that was just partway through the wall extends all the way through the wall. And now what's happened is that the jelly that was on the inside gets forced out, and where it gets forced out is just around the nerve. And here is, in this model, is a very brightly colored picture of this jelly that's come out and is sitting right close to the nerve. This is bright red, and this is absolutely correct, because what happens is, as the jelly comes out, your body turns on an incredibly powerful inflammatory response, almost like lighting a match in the area, and the nerve itself becomes inflamed and irritated. This sets off a totally separate kind of pain, different from the first, that deep dull ache. This pain, well, we all know it, because here's your elbow, and there's a nerve that runs under there, and if you whack your funny bone, you set off a shooting funny pain in a thin band with numbness and tingling into your fingers. This nerve runs across your buttock and down your leg, and when that becomes irritated, what you feel is a thin band of pain which shoots across your buttock and down your leg with numbness and tingling. So, to summarize, the initial injury causes a small tear in the wall of the disc, and this tear sets off the classic pain of lower back pain, which is a deep, dull ache which you feel in your back and often radiates out into your buttock. It is fairly localized, but can be very severe. When the tear extends further and it goes all the way through the wall, then the jelly that's in the middle of the disc gets forced all the way through that, and it comes out and sits around the nerve, irritates the nerve, and sets off the second pain, which is the pain of sciatica. And this is a sharp shooting band of pain that goes all the way across your buttock, down your leg, and is often associated with numbness and tingling. So this is the classic picture, this is the presentation of a prolapsed disc with dull ache and shooting pain. This video is to explain the underlying basis. Our next video is going to be looking at the natural history of this condition and how you can best manage it, and if that doesn't work, what other options of treatment there are. Thank you very much.